Hello people, in this video we want to understand mesenteric cyst. So here they have shown you a mesenteric cyst which has been excised. So this is, first of all, what is mesentery? See, mesentery here they have shown in yellow. It is holding your small intestine, etc. Right? So it is an organ that attaches the intestine to the posterior abdominal wall. Okay? It is formed by the double fold of peritoneum. And what is its job? It will help in storing fat and it will allow blood vessels, lymphatics, nerves, etc. to supply the intestine. So basically it is holding and attaching this intestine to the posterior abdominal wall. So in this there will be a cyst. So how will this be? It will be a cystic swelling in the abdomen. So it is a congenital, it could be congenital. So you should understand that you will see it in young children and adolescents. There are two types which mainly they are talking about, enterogenous and chylolymphatic. Okay, so anyways there are two more types. Anyways, just remember it can be enterogenous or chylolymphatic. It will be there in young children and adolescents. It's a congenital cyst. So where will you see the cyst? It is located in the umbilical region. Okay, so you know your umbilicus, right? Around that there will be there. And how does it move? It moves in right angles to the direction of the mesentery. We will look at all this, don't worry. So basically, there can be, tuberculosis of the peritoneal folds which can manifest as a mesenteric cyst. Okay, so this is something. It's a various among the various forms of abdominal TB. One of them is this tuberculosis of peritoneal folds, where you can see mesenteric cyst. Okay. Now, so they told you, right? It is going to be around the umbilicus, a mass, right? So. The word they are using here is a cyst, right? Cystic swelling. So here there is something called as Tillaux triad, fluctuant swelling near the umbilicus. Okay, there is a fluctuant. This swelling, but it is fluctuant. It kind of how do you define fluctuation? So it's a fluctuant swelling because it's a cyst, right? It is fluid filled. So that is what it is, fluctuant swelling near the umbilicus. Its movement is perpendicular to the line of mesentery. This they have said 100 times. Even in the definition they have written this. It moves perpendicular to the line of the mesentery. So if this is the line of mesentery, it will move perpendicularly. So that makes so much sense, right? Here they are showing you, first of all, they are showing you that this is the line of the attachment of the mesentery. And how will this mesenteric cyst move? Perpendicular to the line of mesentery. But it can go that way or this way, but definitely it is perpendicular to the line of mesentery. It is dull sounded by a zone of resonance. So how will it be? It will be dull sound, surrounded, sorry, it is dull. It is dull and it is surrounded by a zone of resonance, okay, because abdomen, okay, and traversed by a band of resonance, okay. So all that is about percussion, isn't it? Resonant, dull, etc. See, the mobility of many masses you should know. So how will you know it is mesenteric cyst? Because it is moving in an angle. How is it? Sorry, it is moving at perpendicular direction of the line of attachment of the mesentery. So right angle to the direction of mesentery. So here they have shown many intrinsic mobility, but here we are focused more on what? On the mesenteric cyst. So here you can see that the mesenteric cyst is moving. How? If this is the line of attachment of the mesentery, it is moving. How is the mesenteric cyst moving? It is moving perpendicular. Okay, so that's all you have to know. Other things will move how? Side to side movement for some things, vertical movement for some things, right? All directions an ovarian cyst can move. Kidney push back to renal. Pancreatic cyst, adenoma, tree top mobility. So let at least know gallbladder. Gallbladder one goes side to side, they are saying. And ovarian cyst goes in all directions. So you can see here, ovarian cyst, it moves in all directions, okay. Vertical, which one is vertical? Transverse colon will move vertically, okay. Tree top mobility they have shown here. Pancreatic cyst, adenoma, tree top mobility, okay. They didn't show the gallbladder one here, side to side. That one they didn't show photo, right? Okay, yes, here we are focused on what? Mesenteric cyst. It is going to move perpendicular to the line of attachment of mesentery, okay? Now, what are the types? So, types, we'll look at types now. Types of what, guys? Mesenteric cyst. So, look at here, mesenteric cyst, the types are chylolymphatic cyst, enterogenous cyst, urogenital, remnant, and teratomatous dermoid cyst. Okay. So main things you remember here is the chylo. Chylolymphatic cyst is a lymphatic cyst arising from the mesentery of ileum, of which part of the small intestine? Of the ileum, okay. So, it is thin-walled cyst with clear fluid or chyle. So, what will be there inside it? Chyle. Chyle is what? Bile secretion, isn't it? Chyle. Oh no, chyle is lymphatic secretion. Wait. Chyle is lymphatic secretion. Lymph mixed with fat will become chyle, isn't it? So, we should use purple for this. It's chyle. It has separate blood supply. So, enucleation is a treatment without sacrificing the bowel. Because it has its own separate blood supply, etc., etc. I think without sacrificing the bowel, they are able to work on this chylolymphatic cyst. Okay. It is having clear fluid or chyle. Okay. Then enterogenous cyst. Here they have shown enterogenous cyst. Can you understand anything at all? There is a cyst here, looks like. So, basically, it is a duplication cyst from the intestine or due to diverticulum or of the mesenteric border of the intestine. Did you understand anything at all? It is some cyst of mesenteric border of the intestine, is it? Okay. It is thick-walled and it contains mucus. What does it contain? It is thick-walled and it contains mucus. This is what you have to know here. It contains mucus, blue. Okay. It contains mucus, okay. This cyst is treated by excision of cyst with bowel segment because both share the same blood supply. In this, there is sharing of blood supply and we don't like this. Because of this stupid sharing, we had to remove a part of the bowel also. Okay. That's why in this photo you can see some bowel here. Okay. So, enterogenous cyst is mucus filled and it thick-walled and it is share blood supply with the bowel. So, we'll have to excise the bowel also, small portion. Okay. So, what are the four types of mesenteric cyst? Chylolymphatic, enterogenous, urogenital, teratomatous dermoid cyst, if you can remember. Okay. Complications, what will happen? There can be torsion of the cyst. So, that can result in acute abdominal pain. Rupture of the cyst, we don't want that. If there is trauma, then only it will rupture, looks like. Hemorrhage into the cyst. Okay. So, these are the complications. What are the complications? What are the complications of mesenteric cyst? Oh yeah, come on, say it. The complications of mesenteric cyst are rupture due to trauma, hemorrhage into it, and there's a mesenteric cyst here. What will happen to it? What was it? What was the first one? First one. Yeah, torsion of the cyst. Okay, torsion. Okay, now mesenteric cyst, they are trying to treat it, looks like. Look at this. Chylolymphatic cyst, it can be excised without resection of the bowel. Yes, because it is not sharing blood supply, right? However, the enterogenous cyst, it requires excision of intestine along with the cyst. Okay, this is enterogenous. So, there's this part of the bowel they are removing. Okay. So, this is the treatment based on whether it is chylolymphatic or enterogenous cyst. Okay. There is also something called a pseudo-mesenteric cyst. What the hell is this now? Anyways, it is due to caseation of mesenteric lymph node. What do you mean by caseation? Caseation. We have heard of this caseating necrosis and all that, right? Basically, this caseation is a condition which is characteristic of tuberculosis, okay? Diseased tissue will form, dry mass, cheese-like. Okay, we'll go with cheese-like. Cheese-like, okay? Cheese-like. Caseation of mesenteric lymph nodes because it got confined between the two leads of mesentery, okay? So, due to adhesions, etc., the intestine can get kinked and twisted because of this pseudo-mesenteric cyst and cause intestinal obstruction. So, here they are showing you in the photo below here, they are showing pseudo-mesenteric cyst, okay? So, that's it for now, guys. In this video, we looked at this topic, that is mesenteric cyst. Basically, it is a cystic swelling of the abdomen. This is the mesentery, which is an organ which is holding the small intestine and the colon, and it is tying it to the posterior abdominal wall. It will help in supply of lymph, blood vessels, nerves, etc. It is fatty. Okay. There can be a cyst in this mesenteric cyst. Basically, it's congenital. You will see it in young children and adolescents. There are main two types that they are talking about is chylolymphatic and enterogenous. The cyst is in the umbilical region, it will be located, and it will move right angles to the direction of the mesentery. This is very important. They are mentioning it everywhere. Now, in various form of abdominal TB, you can see tuberculosis of peritoneal folds. There also you can see mesenteric cyst. Mesenteric cyst has this Tillaux triad, where you will see fluctuating swelling near the umbilicus, because obviously it's a cyst, fluctuating swelling near the umbilicus. It moves perpendicular to the line of mesentery. So if this is the line of mesentery, the cyst will move perpendicular to it, okay, and it's dull, and it is surrounded by a zone of resonance traversed by a band of resonance, okay. It's dull, surrounded by resonant, at least that much you can remember. The way it moves is perpendicular to the direction of attachment of the mesentery. Then coming to the types, we told you chylolymphatic mainly and enterogenous. There are two things. Other than that, there is some urogenital remnant and teratomatous dermoid cyst. Chylolymphatic cyst, basically it is arising from the mesentery of the ileum. It will be containing clear fluid or chyle. Enterogenous cyst is again of the intestine. Here it will be thick walled and contains mucus. Okay, mucus, thick walled and mucus. The thing with this enterogenous cyst is it shares blood supply with the bowels. So some amount of bowel also you'll have to remove with the enterogenous cyst, which they have shown here. The good thing about chylolymphatic cyst is it does not have it does not share blood supply. So you can just enucleate it without without sacrificing the bowel. Okay, chylolymphatic is slightly better, looks like, because it will have its own blood supply. Complications if you leave the cyst, basically it can get into torsion and result in acute abdominal pain. It can rupture due to trauma. Hemorrhage into the cyst can happen. Now, how do you treat? Like we told you, the chylolymphatic cyst, you can excise it without resection of the bowel. The enterogenous cyst, you will have to excise with a part of the bowel which shares the blood vessel, right? There is something called a pseudo mesenteric cyst. Basically, it is caseation of the mesenteric lymph node between the two leaves of mesentery. This is pseudo mesenteric cyst, remember. And because of these adhesions, there can be intestinal obstruction. So here they have shown you pseudo mesenteric cyst. Okay, but in this video, what did we want to look at? Mesenteric cyst. Okay, bye bye.